This is a training program that everybody in the company gets to go through, or everybody that's affected by this program, let's say, gets to go through, and this is just basic ISO awareness. Avion is pursuing ISO certification, followed by, after that, TL certification. So this is just kind of the first steps. So everything has been kind of plugged into place and organized, and so now it comes time to turn everything on and get it started. My name is Mark Randig. I was brought in 2-3 months ago. As a consultant, that's what I do. This is what my company does. My company is MAS, and we do nothing all day, every day, 365 days a year to help companies get certified. Since we're in Atlanta, we were asked to come up here and work with you guys. So what we basically put together was a 6-month program to get you guys prepared, get you guys implemented, and then ultimately get you guys certified. So right now we are looking at towards the end of the year, possibly into the beginning of next year. And if all goes well, you guys will have your little ISO 9001 ticket to stick up on the wall and say that you're certified. What this is awareness training. This is just a very brief program for everybody to go through, just so everybody's on the same page. We're not trying to create experts. There's not going to be a test. There is a test, but we're not going to give it to you for this. All we're trying to do is just make sure that the communication is even, the awareness is even, and everybody's got the same kind of general clue as to what's going on. As far as just kind of the general process in terms of getting certified, the first month and a half was really focusing on documenting the system and defining what the system looks like. The next month and a half was implementing, putting the various pieces in place, and that's about where we are right now. The following month and a half will really just be letting the system run, collecting objective evidence, proof that we're actually doing what it is that we say that we do. And then finally, we get into certification, where there'll be a number of different assessments or audits to verify compliance. Now, the scope of this system as of this time is really just the products and the services that are offered from these 4 walls. So we're not trying to blanket Avion as an entire company. We're not trying to hit all the various locations. What we're trying to do is just get this location certified. And Joseph, the scope is? As applicable to these office only. Okay. There's actually a scope, and the scope is what's going to be on your certificate. And just for the record, as applicable to the provision of IT staffing and consulting services, as well as configuration and installation support. So we're not building towers, we're not actually handling the installation in terms of the way the system is scoped, configured, and laid out here. If there's additional pieces that need to be added on as time goes on and the system expands to cover more locations and more activities, there's provisions for that, but this is the current scope as of right now, and this is the certificate that Avion is pursuing. So far, so good? Okay. So this system is based on ISO 9001, which is the general requirements for quality management. Quality being, if we wanted to make just kind of a quick and dirty definition of it, the ability to achieve the customer's requirements or to meet the customer's requirements. Basically, us doing a good job. 9001 is an internationally recognized system. It's general requirements, so it's obviously the most kind of universally accepted. But with that regard, too, it's not necessarily industry specific, such as the TL, which will follow later. As far as what is ISO, it's a worldwide federation. Various member countries get together and actually make up all these different international standards. So even though it's the International Organization for Standardization, when you jumble everything up and translate it, it somehow ends up being ISO. I don't know how it works. I don't know. But it is the basis for Avion's quality management system. As far as 9001, 2008, the 2008 is the most current version of the standard. Before that, there was 2000. Before that, there was 1994. The standard used to be very element-based. It used to be very quality assurance heavy. There used to be a lot of shalls, and it created a lot of paper. In 2000, it was revised and adjusted to what they consider now to be a process-based approach. And the reason for this process-based approach is, or the concept behind it is focusing on outcomes and interactions versus actually just mere compliance with requirements. So it moves from a compliance-based system to a more performance-based system is basically the gist of it. As far as Avion's system on paper, now this chart here is actually part of your quality management system. It's actually part of your quality manual. If this looks a little bit confusing, it's a little busy, but it's just basically a circle. If you look at from kind of the right side around, we begin with management responsibility. And what the 5 means is just a chapter reference. We begin with management responsibility, and this is management's responsibility for setting goals, objectives, targets, the direction of the company. And if management's sincere, this commitment will actually be demonstrated through the appropriate provision of resources, so manpower, methods, infrastructure, work environment. These resources then get applied to the actual service delivery. This is what you guys do over here. You know, all the way from the customer and their initial inquiry, all the way from to delivery of service. So this is the sequence and transactions that occur. You know, be it inquiry, that gets transformed into a proposal. If the proposal is good, hopefully we get an order. From there, if it's a staffing job, there'll be a personnel review and assignment of personnel to the job, dispatch, the actual service itself, and then reporting is necessary. Once the service is provided or delivered, then we're going to take a look at actually how we did. So we're going to take a look, was there issues with the service itself? Was there any significant issues that required corrective action? Were there any opportunities that we identified during this work, that we could actually make ourselves better or prevent issues in the future? Were there any customer complaints or any issues with customer satisfaction? And then through a review of work records, and objective evidence, how did we do and were we compliant? So what we're doing is we're looking here at the current state, how well we did, so that this information goes back to management so they can make better decisions going forward. So you have the current state and then the future state. And this all keeps just going around in a circle, and hopefully everything gets better each time. Does it make more sense now with a little bit of explanation? And it's a little bit jumpy. But that is what's in your manual in terms of the sequence of interaction and key processes. So under ISO, then, it becomes a matter of where exactly does everybody fit. You have almost everybody in the company has some part of responsibility in some portion of this overall picture. Even, being the receptionist, that still deals with the customer and, communication. Management, of course, setting direction. HR, in terms of ensuring appropriate personnel. Really kind of the only things, some companies want to say, this part isn't covered under ISO. This is our non-ISO stuff. Really, that extends about into accounting, and that's about as much as you can get away with in terms of saying, well, this isn't ISO, because the rest of the company has some relationship to something, here, even if it is just talking with the customer. Reasons to follow ISO. Joseph, why are we doing this?
So make sure that we have a standard, quality standard.
Okay. So we want to standardize our work. What else are we doing?
Improve services, quality.
And what else?
And also improve process.
And the number one reason being?
Customer satisfaction.
Or did the customer require this?
Customer satisfaction.
Okay.
Customer satisfaction.
And it's up to management of the company to actually ensure that that message is communicated. That's why I'm having you answer the question. In terms of exactly what the point is. When it comes time for your audit, when it comes time for certification, there's going to be an audit team or at least an auditor that will come in and want to take a look at your documentation. They'll want to take a look at your records. They'll want to take a look at any work in progress, and then they're also going to want to do interviews, which means that by the end of the day and by the end of this entire certification process, they will have talked to just about everybody. These are the kinds of questions they ask. Why are you attempting to do this? So at the end of this presentation, there's a whole list of questions they ask. like I said, we do this all day long, so the questions are pretty straightforward. They're also very common. Yeah.
Is this, some years ago, at a company I worked for, is this related to business process management? It seems like it's completely the same thing. Or,
Yeah.
okay, that's what I wanted, because I'm looking at it going, this is business process management, okay.
Yeah, it basically is, and what's with a lot of these international standards is they'll kind of look around and find best practices,
Okay.
and then they kind of consolidate them up as international
All right.
standards.
I just wondered, because I'm thinking, boy, this looks an awful lot like this other training I had. Okay.
Yeah, you've got, and there's quite a number of these different management system standards, and all kind of based on the same stuff. You know, you have it for quality, you have it for health and safety, you have it for environmental, you have it for social responsibility, you have it for turning off your lights, you have it for, you know, recycling, you know, your toner cartridges. There's
you analyze something from A to Z and then see where the problems are.
Yeah, there's this whole plan, do, check, act law that everything
I just
follows.
wanted to carry on. I didn't mean to interrupt.
No problem. So, as far as Avion's reasons for pursuing ISO, customer satisfaction, continuous improvement, standardization of work processes, you know, and ensuring, you know, consistent results. Now, as part of this program, Avion has established a quality policy. And as part of the quality policy, what are we emphasizing?
That's right here.
Three things here. The first one is quality, ensuring, you know, that we deliver, you know, or meet the customer's expectations. The second one is customer satisfaction. The customer's happy with the results. And then the third, continuous improvement. So as we do things and we learn from how they're being done, we do them in a better way. Right now, what you guys are doing is basically starting a quality management system, and over time, in fulfillment of this policy, things should change. They should get better. You know, there may be missteps along the way, but if everything kind of follows the natural progression that's been laid out here, through, you know, consistent result, you know, consistency of processes, you know, through, you know, the analysis of data or management by fact, you know, emphasis, you know, should be going in this direction, and actually, you know, not only just having this as a statement, but actually having this as a goal, you know, and all things lead up to fulfilling, you know, the statement here. With that, it goes from being just a policy on a piece of paper to actually then being quantified. You know, so if we say customer satisfaction, what exactly do we mean by that? You know, that we send out customer surveys, they send us back their feedback, and we have specific goals we want to meet. You know, in terms of, you know, quality, you know, what is consistent work? What is the definition, you know, of that? And, you know, are we meeting it? And again, all this goes back to the picture, you know, where you have the current state. You know, this is where we're at based on data, based on fact, to where we want to go. You know, this is, you know, the ideal state, the current state. You know, then this is where our objectives come in. Right now, there are not quality objectives have not been established, and the reason for that is because limited data. So as the system progresses, as time goes on, there'll be more information on how things are going, and it'll be easier for management, you know, to determine exactly, you know, this is, you know, what we want to achieve going forward. These are to come. The only reason we bring these up right now is so that you guys have been introduced to it, and then you'll know what it is you're seeing, and then you'll know, hey, I was told about this, hey, these are quality objectives, hey, this is the question that the auditors are asking me when they show up. Performance goals for the company is KPIs, in other words. As far as the documentation that makes up the system, so again, all of this documentation here, you have quality manual, which is, you know, in and of itself just more commitments, operating procedures, which take those commitments and actually define them in terms of processes, responsibilities, outcomes, then work instructions, which take it a step further and actually detail step-by-step tasks. So in terms of the way the documentation is laid out, if you were to put a little flag on the top of the mountain, a little flag on the top of the mountain would be the quality policy. So that's kind of like the pinnacle. So the quality policy sits above all else, and then all the documentation, you know, define exactly how that quality policy is going to be achieved. The quality manual may say, you know, we're going to ensure that customer requirements are adequately, you know, determined before we accept any work. The operating procedures would say, this person's going to be responsible for inquiries, proposals, and quotes, and they are going to review the order this way, and they're going to put their signature on it before releasing it to processing. Work instructions would actually be the step-by-step details in terms of use this sheet, attach to this sheet with the staple, must use blue ink, not black ink, may only be photocopied twice, what have you, and then put a stamp on it. So the level of detail increases as you go down. And then depending upon what it is you're looking at, there could be records of various different levels depending upon just what it is. We tried to keep the documentation for this stuff as light as possible, knowing over time that it's going to grow. You guys aren't making nuclear weapons. You're not launching satellites into space. So the stuff really doesn't need to be terribly heavy at this point. Over time, there may be things that can actually be adjusted a little bit, and maybe things that can be reinforced would probably be a good word for it. But as of right now, things can be fairly light because everything's fairly new, and as long as the minimum requirements are met, that's really kind of the best starting point. We're not trying to start, with a super heavy, super robust, super system because you guys are fairly small. The scope of the system is really fairly light. Even though the outcomes and the technology may be advanced, what you guys are doing in terms of the service delivery part of it, it's fairly straightforward. So, anyways, this is what the system looks like. Within the manual, there is 8 sections and a revision history. So if you add them all up, that makes 9. That's why there's 9 sections here. The reason for this is it matches up with the ISO standard. So where the ISO standard has a requirement, your quality manual has a requirement, then you have a procedure, then you have a form. That's kind of typically the structure. And what the forms are just means of collecting the records that are required by the procedures and required by the standard. The first 3 sections are really just an introduction to the system. They, present the quality policy for the company with its emphasis on quality, customer satisfaction, continuous improvement, but also the scope, of the system, IT, installation, support, staffing, and related consulting services. And then when you get into 4, 5, 6, 7, 8, that's really where we're talking about the system itself. That's where we're talking about management responsibility, provision of resources. ISO calls it product realization. If you look up realization in the dictionary, it just says to realize, so we can consider that to be unique stuff or deliver service. So the provision of service is what sits in product realization, how we go about, transforming that customer inquiry into an actual order, into an actual service, into an actual outcome of the service. And then measurement, analysis, improvement, how we're going to actually monitor our performance to see how we're doing and then determine how to make it better. In terms of these procedures, so the manual's fairly general. The manual's got a lot of commitment statements in it. It's got some technical details in it where there really wasn't a need to, create a separate document. Below the manual, these procedures. And the procedures deal more with the actual processes that are being discussed, the responsibilities, and then the overall outcomes. As far as the procedures go, 6 of these are mandatory. So document control is a mandatory procedure. ISO says you have to have it. And what document control is how we manage the information that tells us what to do. All these documents are telling us to do something in one way, shape, or form. Control of records is how we're going to keep the proof that we actually did it. If we say we're going to review contracts, the record would be the contract with the signature on it. Training, how we're going to ensure the competency and awareness of employees. First off, we're going to put you through this training. So this is the first requirement in your training procedure that everybody goes through ISO. Sales and order entry, how we handle and process contracts and orders. Procurement control, how we deal with subcontractors. Internal audits, how we periodically verify that the system continues to meet requirements. Control of non-conformances, what happens if there is an issue with materials, workmanship, any purchase product that we may have. Corrective action, if there's a significant problem, that occurs within the delivery services, through the operation of the system, how do we deal with it? And then finally, preventive action, there hasn't been a problem, but there could be. We've never had a problem with how we review our orders, but to ensure that we don't have any problems going forward, we're going to add a form. We've never had a problem with how we, subcontract out work, but in order to make sure we don't, we're going to add, some additional language to our contracts. What have you. So far, so good? Okay, so each of the slides after this is just kind of one page on the same subject. So we gave each one of these procedures its own page. You guys have pretty much learned most of it already. So this should be fairly quick. As far as control of documents, this used to be in kind of old school days where everything was on a piece of paper and everything had a signature on it and everything had a stamp, and then you logged it out and had the manuals floating all over the place. Being that it's 2013, the easiest way to do it is really just put it on the server. So your documents are in PDF and they're sitting on the server, and that's how they're controlled. Now, as far as any issuing of the documents, I may have skipped this totally. Joseph is the management representative for the system. So whenever we're talking about a lot of this stuff here, this is actually the responsibility of the management representative. The management representative is responsible for developing, implementing, and maintaining the quality management system, as well as promoting the requirements, making sure that everybody's aware of what the rules are, as well as communicating to top management on the performance of the system, performance of its processes, then also acting as the liaison, that's ISO work, right, ISO language, with external parties. So that's the job of the management representative. So in terms of document control, the documents have been put on the server. The management representative has a log for documents if they were needed to be issued. Say we needed to send a copy, to somebody in paper, say a client one-to-one, there's actually a log. Any documents that are on the network, on the server, in their location are considered to be controlled. If they're anywhere else, they're not controlled. So it's the fact that they're electronic, they're on the server, and they're in the right location. And any additional information, the procedures QP423. And again, the reason for the numbering is because the quality manual, if you look at it, document control is addressed in paragraph 423. And then if you look at the ISO standard, document control is addressed in paragraph 423. So everything is 423. If you see a form that says 423.1 or 423.2, those all relate to 423. So you guys see the numbering? Control of records. Records, again, the proof that we actually did it. The documents tell us what to do. The records are the actual proof that we did it. So if we say within the quality manual, we're going to periodically review our performance, and once a year we're going to have a management review. And this management review, we're going to take a look at inputs, the current state of the company, and develop outputs, recommendations or actions for improvement. So that's fine and good, but we actually have to do it. So this is where records come in. Records are the proof, or the actual management review minutes, that this meeting was held and that there was actually an outcome. Inspection, in this case here for service delivery, what we're actually talking about is the verification that the service met its desired goals. So if we're talking about the delivery of service, what was the scope of the contract, how was it monitored, and how was it checked at the end to make sure it was actually satisfactory. Surveillance reports, that would deal if there were subcontracted services. Then non-conformance reports and corrective actions would be if there's any issues. And the policy for that is QP424. Again, kind of same numbering system. 620, what we're concerned about is training, awareness, and competence. This right here today is basically just an awareness program. All we're doing is talking to you guys so that everybody knows what's going on. It's not training, there's no tests, there's no competency. You guys won't have to, really perform, any tasks or anything related to this. This is just information. So there is some definitions here. In terms of awareness, just communicating. Training, you're actually teaching, a skill, an ability. Competency being a combination of being able to perform the job. So this is what we're concerned about, is that everybody has actually got the right tools, in order to do the jobs for which they're assigned. Training is broken out really kind of in 3 different sections or levels. The first one being this indoctrination program, so that everybody gets on the same page. Below that would be any sort of specific position-specific training. So, like we have a procedure for sales and order entry. If you're doing sales, it would make sense you were trained on the sales procedure. If you're doing any sort of staffing, it would make sense that you were trained on the training procedure. If you were actually involved in any sort of purchasing of services or subcontracted work, it would make sense if you were trained in that procedure. Kind of see how everything lines up? And then last but not least, any sort of project or job-specific training that may come up as the result of a contract or an order. As a minimum, everybody goes to this. Everybody got a chance to sign? Everybody signs? Okay. How come there's 2 sheets? Okay. Sales and order entry, this is really just how we handle inquiries, contracts, quotes, in order to ensure that customer requirements are defined, that we give them adequate consideration before we agree to do any work, that adequate communication is maintained throughout the entire process. Purchasing, again, this would be, for subcontracted work, particularly. It could, in some cases, be equipment. There is some equipment that you guys have. Internal audits, how we periodically verify the system continues to meet specified requirements. For the short term, it's pretty simple because we're going to have auditors come in. So we're not going to have audit teams running all over the place and you guys being tasked with all this kind of crazy stuff. Just bring in professional auditors and they're going to come in and do your internal audit on your behalf. So that way you get professionals in, they do it quickly, you get a nice formal report. Now there's different types of audits. An internal audit is self-performed or you have somebody perform it on your behalf. This is different from the certification audits, which are external because they come from somebody outside the company. Also, if any customers, came in, that would be external, as well. These you're actually doing to yourself. Control of non-conformances, that can be workmanship, or other issues, that we're responsible for or our suppliers are responsible for. And this is how we ensure that those, problems are addressed before they impact our work or impact the client. Corrective action, what do we do with issues to make sure that they don't reoccur? So you can have, issues that some of them really aren't that important. Some of them customer complaints, audit findings, repetitive issues within service delivery or, trends. All those types of things would fall under this procedure here. This is the procedure before that, the control of non-conformances procedure plus. There's more stuff that you have to do here. Like say if you got an audit finding, that wouldn't necessarily be an issue with service delivery specific. It wouldn't necessarily fall into the last procedure. But in this case, it is significant. It is something that needs to be documented. It is something that needs to be addressed. What this procedure includes is also an evaluation of root cause. Why did it happen? Why did it happen? Why did it happen? Why did it happen? And then from there, after actually understanding the why, you're able to determine how to prevent it from reoccurring. So this is much more involved, and there's a very specific purpose for this particular procedure. Now, the way the system is set up at this time is that Joseph, the management representative, he is managing the corrective action process. So, and the reason for that is to keep things fairly tight and keep things fairly centralized. So we encourage, anybody to bring up issues that may be a problem. But we just don't want each other writing, everybody writing each other up because that causes more problems than it actually solves. So any issues get identified. They can be, sent by email or, however you want to do it to Joseph, and then Joseph will walk whoever's going to be involved through the corrective action process. There's, since this is a new system, there's a lot of stuff right now that's still getting tacked into place. So there is, kind of a growing list of these things already. For one reason, they help us have a list of things that we still need to do, but also, too, they help demonstrate the system and they help us collect data. So there's corrective actions now. Typically, through the audit process, there may be additional corrective actions. It's all part of the natural process. The corrected actions in and of themselves aren't the problem. It's when you do the corrective actions and they fail to resolve, what they're intended to fix. That's where the issues sit at. Now, that's different. Corrective actions are concerned about preventing recurrence, which is different than preventive action, which this is where things get a little fuzzy. This is an actual ISO definition here, which is preventing an occurrence from ever happening. So if it happened and you have to fix it, it's corrective. If it hasn't happened but could, it's preventive. So we want to make sure we don't have problems with service delivery, so we're going to provide extra training. You want to make sure we don't have problems with order entry, so we're going to add a form. All those things are preventive because they haven't happened. Once they happen, they become corrective in nature. Any questions on the procedures? We can talk about it longer if you want. This is a very brief introduction to the stuff. We're not trying to create experts on the topics. All we're trying to do is introduce you to the system. The next part of this is just audits and surveillances, which is important because this is going to become done. And everybody tends to get really kind of freakish about the whole thing and excited about the way everything works, and it's really not that big of a deal. What's important is, if the system itself is sound, if the system is properly implemented, these audits and surveillances, all they're doing is they're just collecting proof, so that as an internal audit, we can say that the system's compliant. As a certification body, they can say that the system conforms, to the standard. It's a fact-finding exercise. Now, as far as the certification goes, this can be very scary for people. Remember that you're paying them, so it's not necessarily in their best interest to throw you under the bus. They've got to do their job, and they've got to make sure that you can, prove everything that they need you to prove. But there's a tendency to get very nervous, and it's really not necessary. And the majority of auditors actually go out of their way to try to get you to kind of calm down a little bit. What the activity is, it's just to verify. It's verifying compliance. It's verifying that the system meets requirements. And it's typically, or it is a review of documentation, records, implementation, or work in progress, and then interviews with personnel. Like I said, they're going to want to talk to just about everybody. And what they want to know is, how well do you understand the system? How well has it been communicated to you? Do you know what you're doing, for your own job? And these are the issues that just come up. And I apologize for my phone dinging. And then this is adequate records, to demonstrate conformance. So all these things that we commit to within the manual, within the procedures, within the instructions, when they come in, what they're looking for is proof. They're actually looking for evidence that we're doing what it is that we say that we do. And if there's no records for it, it never actually happened. Audit interviews, just be truthful. If you don't know the answer, just say, I don't know the answer. If your boss knows the answer, say, go talk to my boss. If your boss doesn't know the answer, go talk to Joseph. As far as a lot of these audits go, I'm just here for moral support. There's not really much I can do because I already know all the answers, but I'm not allowed to talk. So all I can do is just kind of hang out. Just make sure you know what procedures apply to your job. Just to answer the questions honestly. Know where the procedures are at. And Joseph, you're going to give everybody a link to the procedures so everybody can find them. And also the quality policy, with the company's focus on quality, continuous improvement, customer satisfaction, and then what the company's quality objectives are once they are published. Now, when the auditors come in, they're going to ask these questions. Okay, 365 days a year we do this. This is the majority of the questions. What does the quality policy mean? Quality, customer satisfaction, continuous improvement. What are the current quality objectives? Well, we want to have more happy customers. We want to have, our projects finish on time. We want to get X amount of feedback with Y score, for overall service satisfaction. We want to have fewer internal issues related to communication, what have you. But the company's KPIs, the company's goals. How does your work contribute to quality? Well, my part of the puzzle is helping customers ensure customer satisfaction or communication or service delivery. Where's copies of your QMS documentation on the server? How is your work controlled? These are our instructions. How do you know you're doing a good job? Everybody says because I haven't been fired. That is the wrong answer. The right answer is because we have graphs, charts, data, statistics, and our management representative communicates us how we're doing. How do you know your customers are satisfied? Everybody says because they keep coming back. That's the wrong answer. We have charts, we have graphs, we have data, we have actual statistics. Why does ISO certification matter? You know, it does because we want to ensure that our work is standardized, you know, efficient, our customers are happy, and that we have clients that actually expect, you know, this of us. The only other question that sometimes comes up, and that is, what do you think the biggest challenge to getting ISO certified is? I'll leave that to you guys. Yeah, that's one of those things where they're just kind of putting you in a spot. There's really not a good answer for that. You know, you can say, well, probably because everybody's trying so hard. Anyways, any questions on the questions?
What's our first audit?
I think December. So you guys aren't too far away. We have to look, everything's scheduled out, but it should be around November, December time frame. So we just have to hit it because we've got 3 weeks in there too that were lost because of holidays. So I would guess the first week of December.
So between now and December, I assume Joseph is going to be in charge of this, and we'll be
systematically.
Well, I understand this to mean that they'll be loading our system up with what we believe our processes are,
Yep.
and how we control our things, and where we think we have problems.
Yep.
And he'll be answering all these questions for all our projects.
Systematically going through everything.
Okay.
And then whenever your name pops up,
Yeah.
then you get dragged into
may
it.
come back
Yeah.
and say, what's the procedure? How do we, you know, like, because I assume
Right.
somebody's got to go around and document, hey, how do you do this? How do you do that? And that's how that hasn't been done yet.
A fair bit of the top stuff has. It becomes the question of the actual how-tos.
Right.
And the question then is, how many how-tos do we actually need?
Right.
Because if you already know your job, why do you need an instruction?
I got it. I just wondered, because I'm thinking,
Yeah.
man, well, it seems like there's a lot of work still has to be done here.
The majority, the top tier stuff is done.
Okay.
When you get into work instructions, the question becomes, how much do you need? You know, and you see these big systems like, say, Raytheon or
Right.
Siemens or whoever, you know, that have hundreds upon thousands of written instructions detailing every single thing that the company does. Now, you guys are, what, 20 people? You know,
And how deep a level?
how deep do you want to take this? You know, they're good for standardizing work, but if everybody already knows their job, it's not necessarily adding value. Now, that being said, if you're trying to standardize the work and actually have enough stability there for bringing on new people and training them, then maybe you do want to consider it. Some things like software where the entries are forced and you don't really have a choice, do you really need an instruction for that? You always look at the manual. You know, so the trick isn't to actually document everything that you do. The trick is to document what you need to control. You know, some stuff, you know, doesn't necessarily matter. So that becomes, you know, part of an internal, you know, discussion as well in terms of, you know, where are issues. And some of that comes just from having, you know, beginning to collect data and beginning to see where the issues begin to fall. Any other questions? Comments? Concerns? Okay. So as we go through these audits, there's going to be audit findings. The internal auditors are going to beat you guys up like crazy because that's their job. So that's actually not a problem. You want the internal auditors to find as much stuff as they possibly can before you actually get into the certification process and it's for real. As an internal audit, you're doing it for yourself, you know, so you don't want them to cut corners or really, you know, take it easy on you. You want them to be hard so when the certification process starts, you guys are actually in good shape. My guys are all nuclear guys, you know, so they're going to be doing the internal audit. I can't because I'm hanging out with you now. So when they come in, yeah, they're going to go after everything they can. But that'll make sure that there's no gaps or anything missed. So that concludes this presentation. If everybody is out of questions, Joseph is the man to talk to as the management representative. He is spearheading this project, and he also is the one with all the answers. That's all I got.
Joseph's going to be a busy guy.
I appreciate you guys' time.
What is ASO rentals that linked to the TL?
Right.
What is the relationship?
They're basically, TL is an industry-specific version, so it's just plus requirements.
And what does it take once you get certified with ISO 9001? What does it take to?
It's just going through an additional audit process. Okay.
Yeah, our plan is what, after we get ISO certified. And
Yeah, they just turn around and flip it. And
Yeah,
just, yeah.
and maybe 3 months to get TL certified.
They're,
We touch all the telecom gear, like different services.
yeah, you'll see it with TL for telecom, under TS for automotive, under AS for aerospace. They're all variants of the same ISO standard, and what it is industry is just put in their own requirements, you know, for what they want to see. Yeah, so this here has, you know, TL has very specific telecom requirements in terms of benchmarking performance and industry requirements, you know, which you know are just add-ons. You want to jump right into that? You want to give everybody a break? Let's give everybody a break, like 10 minutes.
Probably.
Yeah, we can flip around that fast. Okay. All right. So everybody's good with the ISO QMS indoctrination training? Okay. So as it turns out, I still have one more order of business since everybody is sitting here. Recently, there was an audit by one of your customers. What was the customer? Okay, Altel Leasing came in and did an assessment of your company looking specifically at your safety program. So we're totally changing gears here. That's why I said maybe we take a minute break, but totally changing gears, going from quality to safety. Now, as far as their audit went, one of the issues that had come up was that the company did not have a documented policy for how it handles bloodborne pathogens. And not only did it not have a policy, it had not provided training to any of its employees on it. So the first thing up here is out of OSHA 1910, or out of the OSHA 1910 standard for general industry, and it's part 1030. This specifically, or these specific requirements outline what the training requirements are under that standard. And what that requires is that the organization provide training on bloodborne pathogens on an annual basis. And we'll get into exactly what bloodborne pathogens is here in just one second, because I know this is totally changing gears on me too. What my company does, we actually deal with quality, health, safety, environmental. So we actually deal with all three. Usually we don't just do it all in the same presentation, but this is a regulatory requirement, the training that you guys are about to get. This is the only reason that I put it up here. It's fairly simple. It's fairly straightforward. You guys are not in the medical profession. You guys aren't, you know, dealing with, you know, a lot of sick people or anything like that. You know, you're not EMTs or firefighters. So your risk of bloodborne exposures is relatively low. However, this is still required training that you guys have to go through. So what we have is just a really quick video presentation, followed by a short review of your actual program itself, and then a couple short quiz just to prove that you guys were here. You really need a separate sign-in sheet for this. Just FYI. As far as the training presentation goes, this isn't going to come up in terms of volume, is it? All right, I'm going to have to bring this way up.
This course addresses the occupational exposure to bloodborne pathogen standard. OSHA's bloodborne pathogens is a federal OSHA standard that prescribes safeguards to protect workers against the health hazards from exposure to blood and other potentially infectious materials, and to reduce their risk from this exposure. Table of Contents. Lesson 1. Introduction to bloodborne pathogens. Get ready. You are now ready to start the course. Lesson 1. Introduction to bloodborne pathogens. Lesson outline. Introduction to bloodborne pathogens. What is a bloodborne pathogen? Bloodborne pathogens are microorganisms such as viruses or bacteria that are present in human blood and that can cause disease in humans. These pathogens include, but other potentially infectious materials. In addition to human blood, blood-borne pathogens can also be found in other potentially infectious materials, including the following body fluids, especially because of their potential to be contaminated with blood. Blood products, such as plasma or serum, saliva in dental procedures, semen, vaginal secretions, skin tissue and or cell cultures, any other bodily fluid that is visibly contaminated with blood. The following body fluids are not expected to be infectious sources of blood-borne pathogens unless they are visibly contaminated with blood: vomit, tears, sweat, urine, feces, sputum, nasal secretions. Note, since you may not always be able to tell whether a bodily fluid has been mixed with blood, it is best to treat all bodily fluids as potentially dangerous. Transmission of blood-borne pathogens. Blood-borne pathogens can be transmitted when infectious blood or other potentially infectious material is introduced into the bloodstream of a person. Transmission of blood-borne pathogens in the workplace can occur through infected blood or other potentially infectious materials being introduced through non-intact skin, acne, scratches, cuts, bites, blisters, or wounds. Contact with mucous membranes found in the eye, nose, or mouth, contaminated sharps or needle injuries. The need for a safety standard. OSHA estimates that 8 million workers in the healthcare industry and related occupations are at risk of occupational exposure to blood-borne pathogens, including, but not limited to, HIV, the virus that causes AIDS, hepatitis B, and hepatitis C. According to the Centers for Disease Control, 100,000 Americans have died from AIDS, and over 1 million Americans are infected with HIV. About 65 cases of HIV infection due to occupational exposure occur each year. About 8,700 healthcare workers are infected with hepatitis B each year. About 200 healthcare workers die from hepatitis B each year. 1 milliliter of blood can contain over 100 million infectious doses of hepatitis B virus. 60 to 70% of the individuals infected with hepatitis C virus show no discernible symptoms. According to the Centers for Disease Control and Prevention, hepatitis C virus infection is the most common chronic blood-borne infection in the U.S. The OSHA Blood-Borne Pathogen Standard. OSHA published the Occupational Exposure to Blood-Borne Pathogens Standard on December 6, 1991. The purpose of this standard is to protect workers by limiting occupational exposure to blood and other potentially infectious materials. In 2000, the Needle Stick Safety and Prevention Act, Public Law 106-430, mandated that OSHA clarify and revise the blood-borne pathogen standard to address the implementation of safer needle devices. OSHA published the revised standard in the Federal Register in January 2001. The revised standard became effective in April 2001. The blood-borne pathogen standard is located in Title 29 of the Code of Federal Regulations, 29 CFR 1910.1030. Who is covered by the standard? All employees who could be reasonably anticipated to face contact with blood or other potentially infectious materials as the result of performing their assigned job duties are covered by the blood-borne pathogen standards. This list shows examples of some of the professions at risk of occupational exposure to blood-borne pathogens. Let's take a quiz to review what you've learned.
No. Get out of the way. Get out of the way. All right. Any questions on the video? Okay. Now, this first part of the presentation, this was just really kind of a general introduction to bloodborne pathogens and to the OSHA requirements. Now, in order to kind of explain this a little bit further, is we actually need to take a look at the company's policy for that.
You want to know?
Yeah, we still need to get. We don't have this.
We have.
Okay. Yeah. So we really should bring that up.
This is just the quiz.
Okay. I thought you'd brought up the actual policy itself.
Okay. You want to print out for each person?
Yeah. Go ahead and print it out for each person.
Okay.
Okay. So while we get copies printed, we do want each person to have a copy of it and at least read through it. Now, when you look at it, and you can see that a lot of this was medical personnel or personnel that would be involved, in first aid or some sort of care. That's not necessarily limited to that. There's cases around the workplace where anybody could be exposed. If somebody got hurt, if somebody cut themselves. And what happens is kind of the first reaction is you want to go up to the person and say, oh, can I help you? I'm going to walk you out to the car, you're bleeding, let me put a Band-Aid on it or whatever. Well, while you're doing that, you're actually exposing yourself to a potential source of pathogens. So you're potentially exposing yourself to what could, be hepatitis B, C, HIV, or other sources, or other types of infectious diseases. So that's the reason for this particular training. Again, as far as the company's established procedure for how it's going to, go about and, control, manage personnel exposure. Now, there is a particular focus here on any individuals that have been assigned in a role of first aid providers. Is anybody here fall under that? First aid? Mm-hmm. Okay, so have you gone through training on it as well?
Yeah.
Okay, so then you've gone through, okay. So, yeah, there is a particular concern there because you basically have signed up for it, just by virtue of that assignment. Now, the company is required to provide PPE. Well, first they're required to provide this training, for all employees, on company time. They're also required to provide PPE for any, employees that may come into contact. Now, you guys do have first aid kits throughout the building? You have one, okay. Now, employees that are not trained, or, on first aid are not required to give first aid. That is actually, something that's been assigned to, I don't know what your name is? Heather. Okay, so Heather's been trained in first aid where the rest of you, guys have received proper training on that. So the expectation of the requirement is not there. As far as, I'm just going to sneak my copy of your presentation of your policy, just so we know exactly what it says like this, makes copies. You guys are also supposed to get a copy of the actual OSHA standard, which I'm sure Joseph will make available to you as well. And then also, if there's risk of exposure to hepatitis B, hepatitis B, that the company is also obligated to give you a vaccination for it. So as part of the policy, there is actually a declination statement as well, should you choose not to get this vaccination. Any questions on anything so far?
So did you say that you have to get this vaccination once you?
Well, no, you can, if you're at risk for being exposed, okay, then the company has to provide the vaccination to you, but there's also on the back of your procedure a declination statement should you choose not to. Obviously, if you were in a position to be exposed, it would be a good idea, but some people just don't like vaccinations or don't trust how they're made. Now, in terms of, any sort of exposure, the first reaction is, or not the first reaction, but the first recommendation is to wash. So if you get something on your hands, you want to wash your hands off, then you want to report it, then you'd actually want to go and find that, and actually get checked. So just wash, report, and then get checked. There should be a report to your immediate supervisor, whatever any sort of exposure does occur. And no employees should participate in biomedical waste cleanup if they have not been trained. I apologize. I'm waiting for just to get the procedure. But yeah, there's really, since the majority of you aren't in the medical professions, since the majority of you haven't been assigned to first aid, it's really just a matter of, being aware that there are bloodborne pathogens, and that if somebody does get injured or somebody is bleeding, then you run the risk of exposure to yourself, and actually, contracting or becoming infected. So this is the reason why, for just presenting this program. There is a short quiz. Do you guys need any more information, or you guys think you're okay to give it a try? Okay. So let's recap here real quick. Now, as far as if somebody coughs on you, would that be a bloodborne pathogen?
No.
Okay. Now, let's see here. Would cancer be a bloodborne pathogen?
Well, I mean,
believe it.
Cancer. No, is it open?
no, it's not a Is that a bacterial virus? Cancer?
Yeah, it's
Or what they say?
If it's an open wound.
It's a disease. That is disease considered a, I guess, I don't know. I don't know how we get cancer from some,
You may be answering your own question.
Why, well, my answer is no.
Okay. Okay. How about measles?
Yes.
Yeah, that's a virus. Well, no, but you
No,
said-
Bloodborne pathogen is
No,
the subject.
No blood.
Bloodborne pathogens is the subject today.
Okay.
So if somebody was to get cut and they did, for whatever reason, have bloody towels sitting on the sink, should they be touched? No.
No, we talked to Heather and tell her to go clean it up. Sorry. He's trained.
Well, at least, or whoever's doing the housekeeping would have to have some sort of PPE, be it gloves or apron or what have you. This actually does become important if people do get hurt, and you want to, because the natural reaction is to take them out to the car or take them to the hospital, and that's where a lot of the potential actually sits. Is helping. So it's important personally. Is this just to make you aware that you're not actually required to help. That by helping, you are exposing yourselves. I'm going to go ahead and just hand this out, just so everybody has the opportunity to go through it. You just need your name on the top and then the date that this was done to prove that you were here. This is only 5 questions. It should be fairly straightforward.